defrauding Medicare, listen carefully, if you're defrauding Medicare, start running, because we are coming for you. So I spent the morning together with a SWAT team that met at 5 a.m. and went after, in our case, the Gills at 6 a.m. with a carefully choreographed effort to shut down fraudsters who have been at it for an earliest recollection from law enforcement around 2018, indictments in 2022. However, hospice in Southern California is an entire different level of fraud. Now, the accused criminals in this case, as Billy mentioned, are a doctor and a nurse. Shameful that licensed professionals will be involved in this. And we've talked about the monetary costs, and I will focus on those as well, but the human cost should not be forgotten. If you're willing to steal money from the American people, from patients, you're willing to sacrifice their health, and you're willing to give up their lives. $100 billion minimum just in health care from Medicare and Medicaid is our estimate. We would double the life expectancy of the Medicare Trust Fund if we could cut out the fraud, waste, and abuse in Medicare alone. So why would almost 1/3 of all the hospices in the whole country be in Los Angeles County? We believe half of them are fraudulent. Half of the 1,800 hospices should not be in business if we are able to identify the red flags. And that's what we're basing these numbers on. World experts at CMS say if you've got 100% or near survival, certainly if you've got a survival over 50% for a population that's supposed to pass in 6 months, you got a problem. If you're clustered in the same buildings as other crooks, if you're sharing employee numbers and license numbers, if you've got a small number of people, less than 50 members, you do that because you can hide what's really going on when they're small because you don't have reporting obligations. There are lots of things going on in California that just are not rational, and we're going to take them out. 7 of them were, criminal charges today. Reba Jabarian, probably read about last night, was had her billing privileges revoked by CMS. Yesterday, she had generated $127 million of billing. And for some reason, although everyone knew that there was a problem there, her 113 agencies that she worked with, 113 agencies, one doctor is working with, had built over the last 3 years $127 million. CMS is going to suspend payments to stop money from leaving the U.S. We're going to review every single hospice in California to make sure that they're all appropriate, and we hope to do that expeditiously. The ecosystem is rotten. Your neighbors in Nevada are suffering because the fraudsters here are now going there, and they have a 7-fold increase in hospice because when people get a little chilled in California, they head there. If you're defrauding Medicare, listen carefully, if you're defrauding Medicare, start running because we are coming for you.